Hi, my name is Marty Holmes, and my presentation is about the need for complementary treatments to manage lupus. The reason I chose this subject is because I am a lupus patient. I struggle with managing lupus, and I decided to take charge of my health. Lupus is Latin for wolf. I will discuss people with lupus that feel the need to seek complementary treatments. Most patients share the common problem that their prescription medicine doesn't relieve all their symptoms. What if the medication you were taking for your disease didn't treat all your symptoms? What would you do? This is the problem lupus patients face. Lupus is a disease with various symptoms. Because prescription drugs don't alleviate all the symptoms, lupus patients seek complementary treatments to manage unresolved symptoms. Your most common symptoms are fatigue, fever, joint pain, stiffness, swelling, and skin rashes. But there are still other symptoms, such as weight loss, hair loss, anemia, kidney problems, blood clotting, sensitivity to sunlight, mouth ulcers, and butterfly-shaped rash across nose and cheeks. Common prescriptions: hydroxychloroquine, which is a Plaquenil, and prednisone, which is a steroid. My source for this was Serato. What is lupus? Lupus is an autoimmune disease. It affects many organs and has many symptoms. What are complementary treatments? These are treatments that can be used along with traditional medicine. Lupus patients feel their prescription medication doesn't treat all their symptoms. Patients are left to use their own judgment to seek ways to resolve these untreated symptoms through complementary treatments. The goal is to use complementary treatments to manage lupus. Solutions others have used: nutrition-related or elimination diets, supplements, herbs, and homeopathic. Health-related: massage, acupuncture, chiropractic, and others. What I feel is the best way to deal with the lupus symptoms are tracking of triggers. Tracking triggers with accountability partners would be beneficial. If you know what triggers your symptoms, you can make adjustments to avoid flare-ups. This can improve the lupus patient's quality of life by living symptom-free. There was a test study called the MIME protocol. They used technology to track triggers. As Rothman and Associates say, there was a 78% improved in the experimental group. This is the group that had coaches. 36% improved in the control group. This is the group that didn't have coaches. It had very positive results. Complaints: unresolved symptoms. Patients complain medication doesn't treat all their symptoms. Flowers notes constant pain regardless of meds, and she also notes pain not going away despite steroids. Complementary treatments and doctor assistance. Rochandel notes complementary treatments improve overall well-being. Flowers notes those who try and don't give up could see restored health. So together, complementary treatments, and doctor assistance can equal improved health. Complementary treatment pros and cons. The pros of complementary treatment are: encourages body to heal itself, relieves stress, and alleviates symptoms the medication doesn't. The cons: not encouraged by doctors, can be costly due to lack not being insured, and not proven. Lupus treatment problem, unresolved symptoms. Lupus is a disease with various symptoms. Because prescription drugs don't alleviate the symptoms, lupus patients seek complementary treatments to manage unresolved symptoms. The tracking of triggers is a way to treat each individual by identifying triggers that lead to flare-ups. Knowing your triggers allows you to make adjustments, which will help patients live symptom-free. In conclusion, managing lupus successfully. It takes time, research, and doctor consultation. Using complementary medicine along with prescription meds will improve the lupus patient's overall health and well-being. This concludes my presentation. Thank you very much.